Absolutely.
Congressman Bishop.
Well, I appreciate the gentlemen both from Pennsylvania and our good friends from Colorado, all over the place here from Colorado. If I'm going to take you off on a stretch you don't want to go into, I'll stop and you can come back to me later. But I do want to try and hit this particular issue because there are other options that are out there which we have not explored. There are those who are saying we've got to do something now because if we don't do something now, we'll lose the opportunity of ever doing it. It doesn't really matter what it is as long as we're doing something. That's not necessarily, I think, true. And if you look at the history and organization of this country, what the Founding Fathers wanted to do, and look at federalism, you will see why that is not necessarily true. The federalism system that we have is in line so that if something has to be uniform throughout this entire country, everyone has to be doing the exact same thing at the exact same moment. We're the only level that can do that. But if you allow states to become involved in this particular system, these laboratories of democracy, you can have creativity, you can have justice because they are attuned to the demographics of each individual area, and what's more important is if you mess up, you don't destroy the entire country. On this floor, we have heard of states that have tried to get involved in health care reform who have messed up. We aren't paying for that. There are states who are doing it the right way. I'm proud that one of them is my state because the president admitted and praised Utah in its effort to do it, and it is going in the exact opposite direction of what we are talking about on the national level. It is going to a system that is based on consumers giving individuals empowered to make choices in a system that comes up with, first of all, allowing three goals of allowing real information so that you can allow consumers to compare and choose and then provide an easy way of enrollment. It's not just about insurance, which I'm afraid we end up talking about here in Washington. It's about the cost of health care. Because let's face it, if we don't control the cost of health care, even with insurance, you still can't afford to do it. So if I have a moment with the gentleman's permission, let me try and tell you exactly what they are doing right there, which is another avenue which is essential to understand as to what our opportunities are and what could happen if we go further with what is proposed by many of the leaders of this particular Congress. Utah is establishing a health exchange, which means any licensed company in Utah can place their programs online. The entire amount of bureaucracy to run this is 2 state employees. So far, there are 66 individual plans that are out there. This is its first year, and the pilot program already has 136 small businesses with over 2,000 employees. They average 17 employees in each company going online to use this system. Now that's important because you've already mentioned the cost that's implied by small business. Only 43% of the small businesses in America provide insurance for their employees because they can't afford it any other way. Utah, it's even worse, only 32%. This is an effort to get around that problem. So what you allow is the workers to choose, not a one-size-fits-all that's chosen by the employer, but a program that fits the workers' needs. They can use that option with pre-tax dollars. The responsibility is with the consumer who gets an annual choice. And with that, there is a pressure to keep prices down and to get quality up because everyone now is a consumer in the system. Businesses in Utah like this because their overhead of mandatory insurance increases now cease. Small business especially because the reason they're not giving insurance is they can't handle the insurance price increases. In this process, the worker gets money from the money that the company would be paying and any money they want to use, and then they go into this plan, and from the 66 programs, they get to choose what is there. Businesses now have a predictable cost of doing business, not arbitrary. And employees, if they don't like the one-size-fits-all, can have the opportunity of finding what they want to do. It's easy to navigate. You go into a computer system, put age, family size, and one thing we don't have today are agents of insurance companies now work with the employer to try and sell a plan. Now they work with individuals to try and service plans because they have freedom to go after any employee in the entire state. It's also portable. If you change jobs and the insurance is still in the system, you take your insurance coverage with you. Even if you don't have a job, you can keep that same insurance coverage with you. There are fewer uninsured, and those that are uninsured, the state of Utah now has a plan to handle this. This is like when I go to the grocery store and I want to pick cereal. I go down the aisle and there's all these different choices of cereal for me to pick. And I always pick the one with almonds in because I like almonds. But there are a whole lot of people that don't like almonds. They get the chance to pick their own cereal. It is not the situation in which the government should be telling me what kind of program is right for me. Not even should be the business telling me what kind of program is right for me. I should be able to pick my own program. And if you do that, you expand the consumer into the system, which puts pressure to lower the actual cost of health care. And that's the real solution. Now, the problem is we have some plans being presented both in the Senate and the House. Those plans crush these state initiatives. Those plans not only cost hundreds of billions of dollars, they decrease choices, they have potential of raising taxes, they destroy state initiatives. Utah and other states have found a better way. What we need to do is make sure that we have a system that empowers states to be creative, to help consumers become involved, and that's not what is being proposed on the floor of this House and in the Senate. What is being proposed would destroy this initiative. It would take it off the table. That's the exact wrong direction. We need to look at what the Founding Fathers had when they envisioned the concept of federalism and recognize that in federalism, in choice, and in options is our salvation. It is the future. We need to embrace that, not a one-size-fits-all government mandate, which has enormous impact, as the gentleman has been saying, especially on the small businesses of this country.
Let me go to